What is pelvic inflammatory disease, PID? PID is a complex infection that occurs when bacteria travel up from the vagina or cervix into the reproductive organs, causing inflammation. It's crucial to understand that while sexually transmitted infections like chlamydia and gonorrhea are common causes, other bacteria, like those found in normal vaginal flora, can also contribute to PID. Causes and risk factors. Apart from sexually transmitted infections, other factors contribute to PID risk, including a history of pelvic infections, previous episodes of PID, insertion of intrauterine devices, IUDs, and certain sexual behaviors. Discussing these risk factors openly with healthcare providers can help in understanding individual risk and taking preventive measures. Symptoms. The symptoms of PID can vary widely and might be mistaken for other conditions. Pain your lower abdomen and pelvis. Pain during sex. Unusual or heavy vaginal discharge that may have an unpleasant odor. Unusual bleeding from the vagina, especially during or after sex, or between periods. Fever, sometimes with chills. Painful, frequent or difficult urination. Diagnosis and complications. 1. Medical history and physical examination. Healthcare providers often begin by discussing symptoms and assessing risk factors associated with PID. A pelvic examination is performed to check for signs of inflammation, tenderness, abnormal discharge, and other pelvic abnormalities. 2. Laboratory tests. Several tests may be conducted to aid in diagnosis. STI testing. Testing for sexually transmitted infections like chlamydia and gonorrhea is crucial as these infections are common causes of PID. Tests may involve urine samples, vaginal swabs, or cervical samples. Blood tests. Blood samples can indicate the presence of infection by detecting elevated levels of white blood cells or markers of inflammation. 3. Ultrasound. Transvaginal ultrasound may be used to visualize the pelvic organs. While it may not directly diagnose PID, it helps rule out other conditions and can detect abnormalities such as fluid collections or abscesses. 4. Endometrial biopsy. In some cases, a biopsy of the uterine lining, endometrium, may be recommended to further investigate the presence of infection or inflammation. 5. Laparoscopy. In certain situations where diagnosis remains uncertain or to assess for complications, a minimally invasive surgical procedure called laparoscopy may be performed. It involves inserting a thin, lighted tube with a camera through a small incision in the abdomen to directly visualize the pelvic organs. Treatment options. 1. Antibiotics. The cornerstone of PID treatment involves antibiotics to target the bacteria causing the infection. Initially, broad-spectrum antibiotics that cover a range of potential pathogens are often prescribed. As soon as the specific organism causing the infection is identified, if possible, antibiotics may be adjusted accordingly. 2. Hospitalization, if necessary. In severe cases of PID or if the individual is pregnant, unable to take oral medications, or doesn't respond to outpatient treatment, hospitalization may be required. Intravenous antibiotics can be administered more effectively in a hospital setting. 3. Partner treatment. It's crucial for sexual partners of those diagnosed with PID to undergo evaluation and treatment for STIs if indicated. This helps prevent reinfection and the spread of infections. 4. Pain management. Pelvic pain associated with PID can be managed with over-the-counter pain relievers like ibuprofen or acetaminophen. In more severe cases, prescription pain medications might be necessary. 5. Follow-up care. It's essential to complete the full course of antibiotics as prescribed, even if symptoms improve. Follow-up visits are crucial to ensure the infection has cleared and to monitor for any complications. 6. Treatment for complications. If PID leads to complications such as abscesses or chronic pelvic pain, additional treatments like drainage of abscesses or specialized pain management strategies may be necessary. 7. Surgical intervention. In rare cases where the infection doesn't respond to antibiotics or if there's a risk of serious complications like a ruptured abscess or ectopic pregnancy, surgical intervention might be needed. 8. Fertility concerns. For individuals concerned about fertility after PID, consulting with a reproductive specialist is advisable. PID can lead to scarring and blockages in the fallopian tubes, potentially affecting fertility. Fertility treatments or surgical interventions might be considered based on individual circumstances. Prevention. 1. Safe sexual practices. Consistent and correct use of condoms during sexual activity can significantly reduce the risk of sexually transmitted infections, STIs, that can lead to PID. Encourage open communication with sexual partners about STI history and getting tested together. 2. Regular STI screenings. Routine screenings for STIs, especially if you're sexually active or have multiple partners, are essential. Early detection and treatment of STIs like chlamydia and gonorrhea can prevent the development of PID. 3. Limiting sexual partners. Reducing the number of sexual partners decreases the likelihood of exposure to infections. However, if multiple partners are involved, it's crucial to ensure that each partner is tested and practicing safe sex. 4. Avoiding douching. Douching disrupts the natural balance of bacteria in the vagina, making it more susceptible to infections. Encourage maintaining vaginal hygiene with gentle, mild soap and water, avoiding harsh chemicals or douches. 5. Seek prompt medical attention. If you experience any symptoms of an STI or PID, such as pelvic pain, abnormal discharge, painful urination, or fever, seek medical attention immediately. Prompt treatment reduces the risk of complications. 6. Consideration with IUDs. For individuals considering intrauterine devices, IUDs, for birth control, discussing the risk of PID with healthcare providers and ensuring STI testing before insertion can help mitigate potential risks. 7. Vaccination. For certain STIs like human papillomavirus, HPV, vaccines are available. Discussing vaccination options with healthcare providers, especially for individuals in their adolescent or young adult years, can be beneficial. 8. Seeking help and support. Encouraging open discussions about sexual health and normalizing conversations about PID, while also shedding light on the emotional impact of the condition and the importance of seeking support from healthcare providers and support groups, can further aid individuals in navigating this challenging situation. Thank you for taking the time to explore the complexities of pelvic inflammatory disease with us today. Remember, your health is a priority, and staying informed is a crucial step towards a healthier future. Don't forget to like, share, and subscribe for more insightful content. Take care, and until next time.